Hi everybody, welcome to Tendinopathy Rehab YouTube channel. Today I'm going to be asking and answering a really important question, that is, should you as a patient think about or consider PRP when you have got a tendinopathy or tendon problem? PRP is platelet rich plasma, and it's a really common injection that is offered for tendinopathy. So I'm going to dive into that in this YouTube video. If you haven't come to the channel before, my name is Professor Peter Meliaris. I'm an academic specialising in tendinopathy and the first ranked tendinopathy expert worldwide. You can get more info about personalised treatments and training courses if you're a clinician in the notes below. So let's dive into this really important question. PRP has been around for a number of years, I want to say decades, probably about 15 years. And it's what they call a biologic injection. So it has, there are biologically active agents within the blood, like platelets, leukocytes, other factors, growth factors, cytokines that are supposed to cause some sort of adaptive or stimulant response within the tendon to help or aid with healing. That's the underlying theory. So it does make sense from a sort of, I guess, biological point of view, that if you put something in there that has the ingredients for healing, or some of the ingredients that you would get if your tissues are adapting and healing, maybe that is going to stimulate you in the right directions. That does make sense. There are lots of studies about PRP, and you can broadly group these into two. One is animal studies, where they show that yes, if you inject it into a healing rat tendon, it will cause some positive effects. The others are human studies, where mostly people look at outcomes like are the people feeling better in terms of pain and self-reported outcomes, or they also look at outcomes like, is the imaging looking better? Okay, and this is where it gets a bit murky, and this is why I wanted to talk about PRP in this video today. So I'm going to link a new systematic review below in the notes, where the title I thought was really provocative and misleading. So the title was that it was based on lateral elbow tendon pain, so pain, it's colloquially known as tennis elbow. And what they did is they looked at studies that had looked at tennis elbow, and they looked at how concentrated in terms of platelets the PRP mixture was. And what they reported is that the ones that had higher concentration of platelets in the PRP had better outcomes. Now, one of the things that they didn't they did disclose it, I shouldn't say that, but they didn't disclose it as a huge limitation, is that the comparators in some of these trials were things like other injections, so other types of injections, and one of them was steroid. Now we know that steroid is a powerful anti-inflammatory that works in the short term, but in the long term can make people worse again. And the best way to explain that is, if you give 100 people steroid injections for their lateral elbow tendinopathy, you might get half of them at 6 months. You might get most of them feeling better in the short term at 6 weeks, but then half of those people that felt better might actually start to feel worse again at about 6 months or even sooner. So, and that's a commonly reported problem with steroid injections. So if you're comparing PRP to steroid at that time point, then you're always going to see that PRP is better, and that's just because the steroid is making people worse. So it's not really a benefit that has been reported, it's just a benefit compared to something that makes people worse. So that was an important limitation that was ignored in this systematic review, which was published in a really good journal. So I think it's important to be able to look at the comparators and what people use. There are also, and I'll link some other studies that show that when you compare PRP to placebo or sham injections in high quality studies that are well powered, then you don't tend to see any difference. And that's also important, and that was also missing from the discussion. So I think when I am trying to inform patients about the evidence, I think it's important to, the ultimate decision about whether to have PRP is the patient's decision. We do, I think, however, have a duty of care to be able to inform people in an unbiased way to say, yes, if you compare PRP to steroid, it's going to be better, but most people that have steroid are worse in the longer term, or a large proportion are worse in the longer term when we're making that comparison. If you compare PRP to placebo or sham, there's actually not much difference. So you're doing something that is probably not much different from a placebo or a sham, and that's a treatment that is looks and feels like a treatment, but actually is not delivering anything that can help you. So the effects therefore are related to some other factor, or they can be related to the strong placebo expectation effects that we know happen whenever people think they're having a treatment. So that's important information to provide people when you're helping them to make an informed decision about PRP. So hopefully that's helpful. And the other reason I wanted to make this video is because we know there's not many things in tendinopathy that we have strong evidence for. So we don't even have strong evidence for the treatments that we recommend most, which is exercise and education in most guidelines. We don't really have very strong evidence for those treatments, but we do have strong evidence that PRP is not better than placebo or sham. That's the one thing we have strong evidence for. So I think it's also, unfortunately, the most common injection that is offered. So it's a real paradox. The thing that we have the strongest evidence that it doesn't work is also the most common injection that is going around worldwide. So, and that's probably because of a lack of other safe options. We've already spoken about steroid, which can make people worse in the longer term. It can have other negative effects as well. There's not really many options out there. So we know stem cells are haven't really been tested. They are not something that's recommended. There's no real option. And we know that PRP, even though it doesn't work, at least it's safe. So people, I think, have gravitated towards PRP as an option. So hopefully that is helpful, and particularly if you're a patient, I'd really love to hear any comments about what your thoughts are about PRP, if it's worked for you, if there's any questions you have about PRP. It'd be really great to hear from you, or equally from clinicians if you've got any questions about some of the evidence there and your experiences with PRP. So thank you very much. Thanks a lot for listening, and I'll see you next time.